Good morning, children. Hope you all are fine by God's grace. I hope all are safe in your homes. Today we are going to discuss about the newborn assessment and the normal characteristic of a newborn. I have already explained you about the care of a normal newborn at the time of the birth. Then the next subunit in the unit 5 is newborn assessment and the normal characteristic of a newborn. I have already explained this in the clinical postings, so I hope that all of you have some idea about the newborn assessment as well as the normal characteristic of the newborn. And also I hope that you have an idea about the reflexes of newborn. So I will just discuss about the newborn assessment and the characteristic of physical features of a newborn. So the newborn assessment, as you all know, we are doing the newborn assessment immediately after the birth. I have already mentioned in the essential care of the newborn. Then the time of assessment is immediately after birth, before discharge, and once in the first 24 hours of life and daily thereafter. So that is the pattern of the time of assessment of the newborn. The next is principles of assessment. So in the principles of assessment, the first and primary principle of the newborn assessment is hand washing. Isn't it? We have to do the hand washing in the before doing the newborn assessment. Then we have to provide a thermal environment to the newborn. I have already mentioned in the essential care of newborn that we have to keep the labor room at a temperature of not less than 25 degrees Celsius. Then we are doing the assessment from top to bottom. So and in all the nursing procedures we are following a particular pattern of assessment. Here the assessment should be from top to bottom. Then brief examination time. So there must be a brief time for examination. The next is APGAR scoring system. I know all of you have an idea of APGAR scoring system. We are performing the APGAR scoring system in the first minute and fifth minute, isn't it? So in the APGAR scoring system, what are the features to be assessed? That is, according to the abbreviation, the APGAR scoring means it is activity, pulse, grimace, appearance, respiration. So in activity, we are dividing this APGAR scoring into 3 scores, that is 0, 1 and 2. So in activity, we are assessing the muscle tone. Okay, we are assessing the muscle tone of the child. If it is absent, we are providing 0 point. We are providing 0 points. Okay. Then arms and legs. If the arms and legs are flexed, we have to give 1 point. Then if the child is active, we have to give 2 points. The next is pulse. The pulse of the child. If the pulse is absent, we have to provide 0 point. Then if the pulse is below 100 beats per minute, we have to provide 1 point. And if it is over 100 beats per minute, we have to provide 2 points. The next is grimace. Grimace means reflex irritability. We have to check the reflex of the baby. If it is flaccid, the point is 0. If there is some flexion of extremities, it should be 1. And if there is active motion, that is if the child is sneezing, coughing and pulling away, we have to provide 2 points. The next is appearance, that is skin color of the baby. If the skin color is blue or pale, the point is 0. Then if the body is pink and the extremities are blue, what is a medical term for that? If the body is pink and the extremities is blue, we are calling it as acrocyanosis. In acrocyanosis, the point should be 1. And if the body is completely pink as in a normal newborn, the point should be 2. The next is respiration of the baby. If the baby is not taking respiration, that means if the baby is not crying immediately after birth, if the respiration is absent, the point is 0. Then if the respiration is slow or irregular, we will give 1 point, and if the baby is vigorously crying, that means if the baby is taking the breath normally, we are providing 2 points. So, according to the inference, the baby is severely depressed if the point is 0 to 3. Okay, so Apgar scoring, it was proposed by Virginia Apgar to assess the normal health status of the child. So if the baby is severely depressed, the point should be 0 to 3. If the Apgar score is from 0 to 3, the baby is severely depressed. Then the baby is moderately depressed if the score is from 4 to 6, and the baby is excellently healthy if the score is from 7 to 10. So this is one of the parameters that suggest if the baby is healthy or not. So it is one of the important characteristic to be assessed in the first minute as well as the 5th minute after the birth of the child. So we can't assess the Apgar scoring even after the 5th minute of birth. So it is the scoring system that we are performing immediately after the birth. Then next we are moving on to the physical characteristic of the child. The first one is milia. What is milia? You all have an idea about milia because we are performing it in the newborn examination. Milia is a white cheesy spots that it is appearing on both sides of the nose, and it is a normal feature, and it is because of the formation of sebaceous cyst on the face. The next is Mongolian spot. Mongolian spot, it is the grey to bluish black lesions that is forming on the, and that we can see on the sacral region of the baby, and most probably the shape of that Mongolian spot will be in a butterfly shape. The next is Vernix caseosa. So Vernix caseosa is a white cheesy exudate or covering that we can see throughout the body of the newborn, and I have already mentioned that this Vernix caseosa is a protection of the baby from the external environment as well as to regulate the thermal regulation of the body. So this Vernix caseosa, we may feel that it is an abnormal condition of the baby, but it is normal. So when we are wiping the baby after the birth, no need to wipe vigorously because it will cause injury to the baby. So this Vernix caseosa will be absorbed to the body itself after some hours of the birth because of the normal body temperature. The next is impetigo neonatum. So it is an abnormal condition, and it is normally seen in children because of streptococcal as well as staphylococcal infection. This impetigo neonatum, it is a bullous exudate that we can see in the especially in the on either sides of the scrotum as well as in the joints of the baby. So this may cause some complications in the newborn. So we have to consult a skin specialist if the child is having impetigo neonatum. Then we are going on to the head of the baby. So if the child is born because with the help of forceps or vacuum suctioning or forceps delivery, then there will be marks on the head of the baby. Then the two prominent features or two commonest features that we can see in the newborn is caput succedinum and cephalhematoma. So caput succedinum means it is a boggy edema. It is a type of edema in the presenting part of the head, and this is because of the because of the difficult labor or because of the prolonged labor of the mother, and because of the early rupture of the amniotic amniotic membrane. If the amniotic membrane is ruptured earlier, it will cause caput succedaneum, and it will not cross the suture lines, and it will disappear in a few days. Then another feature of caput succedaneum is that it is harmless, and it will not cause any injury to the bone or brain of the child. The next is cephal hematoma. This cephal hematoma is most probably because of the vacuum delivery or forceps delivery, and this is subperiosteal, and it takes weeks to resolve because of the formation of the blood clot under the layer of the skin, and it does not cross the suture lines, but it causes injury to the blood vessels, and there will be a pool of blood under the layer of the skin, and it will take weeks to resolve it, and after weeks it will disappear because of the calcification of the blood, and it is absorbed in the body itself. So it is also, there is no need of any further treatment for cephal hematoma. So we have to differentiate the cephal hematoma and caput succedaneum properly. The next is anencephaly. As you all know, anencephaly means there is absence of skull bone. Okay, there will be absence of skull bone, and this is a rare condition, and there will be associated chromosomal abnormalities also to the child. The next is Brushfield spots. This Brushfield spot is also a manifestation of chromosomal abnormality, especially Down syndrome or trisomy 21. This Brushfield syndrome spot is we can see a brush-like appearance on the margin of the iris of the eye. Okay, the iris will be we can see a dark spot inside, and we can see a brush-like appearance, brush-like less pigmented area around the iris. So this is the most prominent feature of the children with chromosomal abnormality, trisomy 21 or Down syndrome. The next is oral thrush and Epstein pearls. This oral thrush is one of the condition because of the infection of Candida albicans. So this oral thrush, it must be treated, and this oral thrush can be transmitted from the infected nipples of the mothers too. The next is Epstein pearls. Epstein pearls is also we can see bumps, that is we can see on the margins of the gingiva, or we can see on the roof of the mouth. So these are sebaceous bumps. There is here also there is no need for any further treatment, but in oral thrush we have to go for treatment. The next is cleft lip and palate. As you all know, there will be a cleft on the lip. There will be the lips are not fused, or the palates are not fused, and we can find it out in the natal period itself. That is, when the mother is pregnant itself, we can find it out through USG and other diagnostic procedures, and this cleft lip and palate can be surgically corrected. Then chest and abdomen. In the chest, I have already told there will be supernumerary nipples, or it is otherwise known as polythelia. That means the child will have an extra nipple other than the two nipples, and it is otherwise known as supernumerary nipples or polythelia. Then in some children there may be presence of milk from the breast, that is, it is otherwise known as witch milk, and it is because of the hormonal abnormalities of the child. The next is meningomyelocele. This meningomyelocele, it is a cyst, it is a small cyst from the spinal cord, from the vertebra. There we can see an outbulging from the vertebra, and it consists of the meninges, spinal cord, meningeal content and spinal cord, and it is one of the dangerous condition which cause some neurological abnormalities or neurological impairment to the child. It should be corrected surgically. Then we can diagnose the meningomyelocele or meningocele from the formation of a lumbar hair tuft. There will be a tuft of hair on the lumbar region, which is one of the commonest manifestation, which is one of the prominent manifestation that shows the meningomyelocele or meningocele, and it is commonly known as spinal cord defects. The next is inguinal hernia, that is herniation of the abdominal contents through the inguinal canal, and this is also this can also be seen in children because of the failure in the closure of the inguinal ring in the prenatal period. Then hydrocele. Hydrocele are these are the collection of fluid in the scrotum, and this is there is no need for further treatment because the fluid will be it will be absorbed and it become normal afterwards. Then the danger signs. There are some danger signs that we have to check whether the child is having the following danger signs. That is, the baby is not feeling well. Okay, not feeding well. If the child is not taking the breast milk well, less active, then fast breathing, that is if the breathing pattern is greater than 60 breaths per minute, then moderate to severe chest indrawing, that is if the chest retraction is more, chest, that is if the expansion and during the expansion and contraction of the chest we have to see for the chest retraction, then grunting, then convulsions. Then floppy or stiff. Floppy means what? The child is not moving well or the child is staying as it is. There is not any flexion position. That actually the newborn should have a flexion position or flexed position, isn't it? If the child is not moving well or if the child is lying straight, without that is the child is attaining an extension position, the child is known as floppy baby. And if the temperature is greater than 37.5 degrees Celsius or less than 35.5 degrees Celsius, then umbilicus, there is drainage of pus from the umbilical ring or umbilicus or umbilical redness extending the skin, that is around the umbilical ring there will be, if there is any redness, it is a sign of infection to the umbilicus. Then greater than 10 skin pustules, then bleeding from umbilicus or umbilical stump. Okay, if the child is having any bleeding abnormalities, that is any that means if there is any clot, if there is any absence of clotting factors, or if the child is having any hemophilia, then the child, there will be bleeding from the umbilical stump. Then next is neonatal reflexes. I have already taught you about the neonatal reflexes. So neonatal reflex, it is also known as developmental primary or primitive reflexes. It consists of autonomic behaviors that do not require higher level brain functioning. They can provide information about the lower motor neurons and muscle tone. So we are assessing neonatal reflexes to find out the the intactness of the lower motor neurons and the muscle tone of the baby. And they are often protective and disappear as higher level of motor functions emerge. So that means that if the child, as the neurological functioning of the child become matured, the neonatal reflexes will disappear. And the main neonatal reflexes are sucking reflex, rooting reflex, then Palmar-Grast reflex, tonic neck reflex, Moro reflex, stepping reflex, Galen reflex, and Babinski reflex. And I have already completed the neonatal reflexes in the previous chapters, so I am not discussing the neonatal reflexes in this session. Okay, so these are the important factors to be assessed in the newborn assessment, and these are the important physical features that we can find out in the newborn. And there are other various findings to be noted from the newborn, but these are the important and the significant features to be assessed in the newborn at the time of the birth. So hope you all understood this session. If you have any doubt, you can ask through WhatsApp chatting. Okay, thank you students.